Hello and welcome back.
Today I'm going to talk to you about Chapter 22, Preparing for Aging, Death and Dying. Some of our learning outcomes. I'm going to define aging and list some of the characteristics of people who are successful at aging. I'm going to explain how there is a growing population of older adults in the United States and how that's going to affect our society. Going to talk about some biological and psychosocial theories of aging. We're going to describe some of the unique health challenges that come along with aging and how to be successful at meeting those challenges. We're going to talk about death and discuss strategies for coping with death, some of the typical symptoms and grieving process associated with death. We're going to talk about a few ethical concerns that arise from concepts of the right to die and rational suicide. And we're going to review some of the decisions that need to be made when someone is dying or indeed has died. So first, let's define aging. Aging is a pattern of life changes that occur as one grows older. Gerontology is the study of the aging process. That includes the biological age of a person, the psychological age of a person. Those two things can be different. Social age, legal age, and functional age. Some people can function at levels that are far better than their biological or legal age. So what is successful aging? Successful aging includes staying active, typically through leisure activities, oftentimes with regular exercise. That exercise can be strength-based, cardiovascular-based, but oftentimes is functional. It's important to maintain a normal weight. It is important to eat a healthy diet, and to eat plenty of fruits, vegetables, and whole grains, and indeed to eat enough calories. Many times the elderly stop eating select foods and can end up with very limited diets with insufficient calories to support healthy lifestyles. It is important to participate in activities that are meaningful for you. Sometimes that's volunteering, sometimes that's social activities, but any activity that gives your life purpose. It's important to avoid smoking and to avoid excess alcohol consumption. Older adults is a growing population. Back in 2016, there were 49.2 million people aged 65 years or older in the United States, and that number is growing. The needs of this generation will have a major impact on the economy, a major impact on the housing market, a major impact on the healthcare system, and of course on Social Security. The number of Americans 65 years and older in millions can be seen on this graph. Here on the left is the number of Americans, and there on the right you can see that the numbers are projected by 2040 and 2060 to dramatically increase in the United States, approaching 100 million people from the current levels of around 50 million people, nearly doubling the number of elderly in the United States. As the number of older Americans increases, there's financial medical needs that become issues for the elderly. More people will be drawing from Social Security, while fewer people will be contributing to the taxes that fund the Social Security system. And healthcare costs continue to rise. Individual costs rise, Medicare costs rise, and sometimes the Social Security and Medicare support may become less than adequate. Housing and living arrangements will be a major problem for low-income elderly in the future. And currently there's a shortage of donor organs and insufficient organs for the people that would like them. Let's take a look at living arrangements for Americans 65 years and older. Around 73% of men and 47% of women are living with their spouse. More men are living with their spouse than women because women typically outlive men. Living alone, around 20% of men and 35% of women. And then other arrangements, typically with extended family, make up about 18% for women and 7% for men. Now, there are a number of theories for aging. I want to talk to you a little bit about some of those theories. They can broadly be categorized in 3 different categories. There's program theories. These are theories that your body is programmed to age at a particular rate. In fact, different parts of your body may age at different rates from other parts of your body. And we sort of know this because some people you will see will go grey earlier than others, and sometimes that sort of pattern can be seen running in different families. There are damage theories as well for aging, and damage is definitely a contributor to aging. One of the popular damage theories states that mutations that occur every time cells divide, naturally occurring mutations occur every time a cell divides. As our cells grow and divide and replace dead and dying cells, mutations occur, and these mutations accumulate. Our system will then register that damage, and that damage will become greater and greater, causing aging. Of course, you can combine these theories, the theories that we've got an external program or an internal program for aging, and the damage theory. You combine those 2 theories together. We know that the program theory is quite well supported, and we know the damage theory is quite well supported. The program theory, you can definitely see the program theory if you look at organisms like pets, family dogs and cats. They have a program which causes them to die at far earlier times than humans. We live to 70 to 80 years of age, whereas dogs and cats typically die somewhere between the ages of 10 and 20 years old. You can also see that they show typical signs of aging at much faster rates. And that is despite the fact those organisms, cats and dogs, live in environments that are very similar. They live in our houses, they live in environments that are very similar to us, and probably undergo much of the same kind of exposure to damage that we undergo. However, animals like cats and dogs do have cells that grow and divide quicker than human cells, so the damage that they occur will also occur more quickly. So both theories are well supported by observations of other species as well as observations within humans as well. Now, there are many physical and mental changes that occur with aging. Some typical physical changes include sagging of the skin, loss of pliability, bones and joints can become brittle and fragile. There are changes in the shape of the head and the face. Noses and ears typically keep growing. Heads can shrink. Skulls can thicken. The urinary tract loses pliability and function. Heart and lungs lose elasticity and some function as well. Eyesight degrades. We can see cataracts as people age, or degeneration of the retina, macular degeneration. Hearing loss through loss of the cells in the inner ear is typical with aging. There can be loss of sexual functions as people age, and there is typically muscle wasting, loss of muscle mass as people age, and that's particularly important for the elderly to exercise and eat protein to maintain muscle mass. Along with these physical and mental changes, there are changes in mental functions, typically with loss of memory, sometimes personality changes, including depression or anxiety, and then there are diseases like the dementias, including Alzheimer's disease. Be aware that dementia and Alzheimer's disease can be misdiagnosed at times. If you're elderly, person is having difficulty with mental functions, be sure that they are not suffering from any nutritional deficiencies. Nutritional deficiencies are quite common and can manifest as loss of memory, depression, and other indicators that might indicate some kind of dementia, when in fact you're looking at some kind of nutritional deficiency, like lack of B group vitamins, improper hydration, lack of electrolytes, things like this. So let's look at the normal effects of aging on the body. The head and the brain, the skull thickens. There's a decrease in brain mass, although the decrease in brain mass is not associated with mental function. There's loss of hearing, particularly at high frequencies. Typically, the high end of your auditory range is lost. The nose and the earlobes become larger and longer on the face. Wrinkles appear. The lungs' vital capacity, that's the volume of air that can be taken in and out, is reduced. Bones and joints become less dense, more brittle, and more prone to breakage. Urinary system, the bladder's capacity declines, the kidneys lose function, hair turns gray, men sometimes go bald, eyesight is reduced, particularly the ability to see close-up objects. Skin becomes thinner, much less elastic. Spots can appear on the skin where damage has occurred. Fatty deposits can appear underneath the skin. Heart stroke volume diminishes, reducing exercise capacity. And then the reproductive system, menopause will cause drops in estrogen levels. That can cause hot flashes, mood swings, and other problems. In men, loss of testosterone can lead to loss of sexual function. Memory loss occurs with aging. Sometimes we see Alzheimer's disease associated with loss of mental function. It is a very debilitating disease. It affects about 5 million Americans. It's a very painful condition for both the patient and the family. Alongside of Alzheimer's disease can often be seen changes in personality, loss of memory, and loss of recognition of family members and so forth. It's a very difficult condition to understand and a very difficult condition for families to cope with. Yes, Alzheimer's disease is a progressive brain impairment. It interferes with memory, normal intellectual functioning. It is the most common form of dementia. And people lose their personality, people lose their memory, and there's a slow decline in body systems. Typically the first stages involves forgetfulness and memory loss. The second stage is characterized by accelerated loss of memory, oftentimes agitation, restlessness, sometimes repetitive actions. And then the final stage, people can become disoriented, completely lose bodily functions, and require care 24 hours, essentially, to be safe. Alcohol and drug abuse. Alcohol consumption and drug abuse, unfortunately, are on the rise in the elderly. Older people typically do not use illicit drugs with the same frequency as younger people, but there is a propensity to misuse prescription drugs and a propensity for doctors to overprescribe drugs to the elderly, and particularly the amounts of those drugs. Unfortunately, there is no single system to track prescriptions, so it is very easy for patients to overdose, particularly when memory is impaired and the elderly are having difficulty remembering which pharmaceutical prescriptions they have taken and at what time. Sometimes they can double up or triple up and overdose on prescription drugs. What are some strategies for healthy aging? First and foremost, improve fitness. When I say fitness, I mean cardiovascular fitness, strength, and functional fitness. Functional fitness is one of the most overlooked forms of fitness in the elderly, but it's really important not to lose functions. Things like being able to bend over and touch your toes and tie your shoelaces. These are functions which require practice in the elderly. It is important to eat for longevity. It's important to eat a diet that's high in calcium and magnesium for bone health, high in vitamin D, again for bone health and for immune system function. Low vitamin D is one of the most common problems for the elderly in the United States. And it is important to eat plenty of protein. Sometimes the elderly lose interest in protein, high protein foods. But protein is essential to reduce muscle loss, and it's essential to maintain protein ingestion to support cardiovascular strength and functional fitness. It's also important to eat a diet high in vitamin E, folic acid, iron, potassium, coenzyme Q, vitamin B12, and other antioxidants. So that would be a diet that's high in fruits and vegetables and whole grains. It's important to maintain healthy relationships. In the elderly, the more relationships, the better. There are many studies that show longevity is directly proportional to the number of relationships and the health of relationships with other people in the aging person's life. Another factor that improves longevity is the spiritual side of life. Basically having some form of meaning to life, something that gives your life meaning, something that you enjoy doing, something that makes life worthwhile. The more you can do that, the healthier you will age. It's important to avoid alcohol and drug use and abuse, and particularly be careful with prescription drugs to make sure that they are appropriate, not overused and not underused. When they're prescribed, they need to be taken in the correct dose at the correct time. Financial planning for retirement is essential. Lacking financial planning can cause a great deal of stress, which can prematurely age. Let's talk about understanding final transitions, about dying and death. Death can be defined as the cessation of all vital functions. Death occurs when an individual has sustained irreversible cessation of the circulatory and respiratory functions, or irreversible cessation of functions of the brain, loss of brain function. Brain death has gained increasing credence as the final arbiter of death. The dying process. In the dying process, Elizabeth Kubler-Ross identified 5 psychological states that people who are coping with death often experience. The first stage is when a diagnosis, a fatal diagnosis is made. It's typically denial, followed by anger. There's usually a bargaining phase, sometimes depression, very common. And usually towards the end, acceptance. Looking at the Kubler-Ross stages of dying in terms of activity, as a person's health stability declines, you can see some changes in activity levels. A person with a terminal diagnosis typically will start with a phase of denial as health declines, followed by state of anger. As this state occurs, people may become more active and difficult to approach. Later, people may become bargaining, or understanding, accepting, and then depressed. depression is undertreated in people who are suffering from end-stage diagnosis. And typically towards the end, people accept that death is on the way. Social death, the loss of a valued or appreciated by others, can lead to a condition that some people call social death. It's when a person is no longer treated like an active member of society. Sometimes this is seen with patients in terminal wards. Nobody wants to interact with them anymore, and this social death is preceding actual death, and it's very harmful for patients. Sometimes there is an inadequate pain control that can contribute to patient suffering, and there is significant anger and hostility sometimes associated with lack of pain control or lack of proper care. And sometimes that anger can make giving assistance to people who are experiencing terminal disease very difficult. This decrease in meaningful social interactions can effectively strip a person of their identity. And it's a very sad state. Unfortunately, people require social interactions all the way through death. After death, coping with loss is a difficult proposition. Bereavement is the process of coping with loss of the person, the loved one that was in your life. Grief is a state of mental distress that is often associated with bereavement and loss of a loved one. Disenfranchised grief, a person experiences loss that sometimes cannot be openly acknowledged or publicly mourned or socially supported. Sometimes this occurs with people who have relationships that are not publicly known. Mourning refers to a culturally prescribed and accepted time period for a particular kind of grief behavior. Unfortunately, everybody responds differently to bereavement and grief, and these culturally accepted periods are actually meaningless for individuals. Warden has a model for grieving tasks. His model defines the following 4 tasks to work through the grief process. As I said, this will be different for each and every individual coping with loss. One step is to accept the reality of the loss. Sometimes that can take a long time. Then there's working through the pain of the grief, the pain of the loss. Oftentimes that is a very individual process. Again, very difficult. Next, people will adjust to the environment in which the deceased is missing. This takes time for a person to develop patterns and habits that no longer involve the individual that has been lost. And eventually a person will emotionally relocate the deceased and move on with life in the best way that they can manage. Children and death. Loss of a sibling, loss of a child can be particularly hard on siblings. A lot of attention is typically devoted to a dying child, and siblings may experience very prolonged grieving periods when that sibling is no longer there. Oftentimes, children may not understand what caused the death. They may not understand whether they will also die, and they may have difficulty understanding if they're going to lose other people in their lives. So children Siblings in particular require a great deal of attention through the grieving process when they've lost a sibling. There are some decisions that can be made prior to death, and some of these need to be thought out ahead of time and clearly documented. For example, in California, it is legally allowed for a patient to choose the right to die. And that means that they can choose to not have electrical or mechanical heart resuscitation. They can choose not to have mechanical respiration. They can choose not to take on feeding via nasogastric tube or intravenous nutrition. They can refuse medication. Be clear about your wishes before you are in a situation where it becomes too late for you to clearly make those wishes known to the medical professionals about you and to family and friends. One of the things that a person can do is when they are conscious and competent, when they know that they would considering refusing treatment through the death process, they can create a living will. This is an advance directive. It is designed to allow people to make decisions about your care in advance of becoming incapacitated. A living will is a document that needs to be very specific. It's important to get an agent, an attorney, someone with power of attorney, someone who is responsible for your health care, to execute this will. You need to discuss your wishes in detail with your proxy, and you need to deliver this directive to your doctor, to the agent who is going to be responsible for your care when you're incapacitated, to a lawyer, and to family members, so everybody is clear about your wishes as you choose and the way you choose to die. There is a concept of rational suicide. It is a reasoned, coherent process in which a person chooses death as preferable alternative to unbearable pain. This is only in a situation where a person is dying and imminently dying. Active euthanasia involves ending the life of a person who is suffering greatly and has no chance of recovery. Passive euthanasia is the intentional withholding of treatment that would prolong life. In California, the End of Life Option Act went into effect in 2016. This law allows terminally ill adult Californian residents to request a drug from his or her physician that will end his or her life. This said, if you know of a person who is contemplating suicide but is not terminally ill, that it requires medical attention immediately, and please call a suicide hotline to get that person help. So let's talk about making final arrangements. Hospice care has the primary purpose of relieving a person who is dying of pain and offering emotional support and also medical support, and can help restore a sense of control for a person that is dying, and allow family and friends to visit as they are dying. Post-death, there are arrangements that will need to be made. Some people like to have a wake or a viewing. Sometimes there are burials or cremations. And for people who are younger and have organs, would like to donate organs, that is a consideration as well. Please be aware that final arrangements post-death can be financially burdensome, so please consider the costs of these for your family. In terms of organ donation, the waiting list for organ donors continues to rise, but the number of donors has stayed relatively level. The number of transplants has remained relatively level. Unfortunately, there are many more people on the waiting list than there are organs available. However, you can choose to donate organs. There are organ donor cards that you can get from the Department of Health and Human Services. Also, in the state of California, you can choose on your driver's license to state whether you are an organ donor or tissue donor or not. I am an organ donor.